Welcome to Bespoke Diaries. Today's article is on The OPD Dilemma, Psychiatrists Edition, by Dr. Wilona Annunciation, founder and psychiatrist, Catalysts, India. It's been a long day. Dr. Wilona sits in the OPD and look with wonder and gratitude as people stream in. All ages, different personalities and so many varied cultures and backgrounds, and she thinks about the days when people would hesitate to reach out for help. In the past 12 years, there has been a notable change in the rate at which people reach out and seek mental health intervention. And it is heartening to see people starting to look inward and realize how important their emotional well-being is. And while she is grateful for the shift, she cannot help but feel frustrated at the common refrain that accompanies the reports of distress, despondency, panic, and hopelessness. "Doctor, please don't prescribe any medications. She just wants to get better, but naturally." To be fair, Dr. Wilona understands where they come from. And it is only the many years she has spent in training that have created in her the awareness that various things, including genetics, environment, past experiences, personality factors and social circumstances, have an impact on a person's mental health. And so, all of these factors mold, shape, and program our minds to behave in specific ways. For most of the individuals that come to her with anxiety and depression, there are long backgrounds of unstable environments, trauma, hostility, and growth in poorly regulated emotional environments. As professionals in the field of mental health, they are very motivated and constantly on the alert to assist those in need or are willing to refer them to the right connect for their optimal benefit. In fact, whether it is a psychiatrist, psychologist, or any other mental health professional, we each contribute in our own unique way to the holistic recovery of those who reach out to us. Why then this constant pressure on us to heal, but with binds? As the stigma surrounding mental illness slowly clears, they now face a new set of difficulties. So many of their clients come with their own methods for addressing problems that in reality actually call for professional clinical intervention. While it is absolutely okay for clients to have questions, be curious, and want to understand the recommended line of treatment, the important message here is that the professionals are there to guide and direct treatment planning. It is truly a challenge for the professional if the client is rigid and unwilling to consider available options. Case in point, Megan came to Dr. Wilona after years of reaching out to therapists with panic attacks, messed up relationship patterns and self-harm, saying that psychology is all hokum and that all therapists do is mint money. After a detailed psychiatric history, Dr. Wilona pointed out to Megan that she was struggling with severe anxiety with depressive symptoms with a background of a borderline personality disorder and outlined to her treatment options including and necessitating medications, regular therapy, and lifestyle modifications. Although initially reluctant, Megan finally agreed to give this line of treatment a chance, and 6 months later, she is doing much better, in regular therapy and on minimal maintenance doses of medications. She exercises 2 to 3 days a week, avoids her earlier alcohol and weed binges and works hard at building sustained relationships with people who truly matter. Dr. Wilona honestly could not have achieved all this without Megan's openness to medication, because she herself realized that she was getting nowhere in therapy alone. There are limitations to what each of us professionals can do in terms of helping the client, and when the concerns are at a clinical level, it is all the more important that we address it with the recommended scientifically validated line of treatment that is available. As a practicing psychiatrist, Dr. Wilona's role is to suggest medications where they can be helpful, insist on medications when they are absolutely needed, and redirect clients to therapy when they would be ideally benefited by counseling support. However, when clients insist there is a huge problem and express intense distress in the OPD, but then turn around and say that they will not follow the recommended strategy, it creates for her a frustrating dilemma. One where Dr. Wilona knows that her recommendation is valid but still understands the limits her profession demands she sets. That the client takes the call, no matter how damning that call may be. This is a genuine conflict in OPD every day, and this is something that she has been dealing with for years now. She often chooses to give her clients the leeway to take their time, to begin the recommended treatment only when they are ready, but when they do, she hopes they give her adequate time to allow her treatment plan to make a difference. And I have found this to be amazingly effective, both for Dr. Wilona and her clients. She dreams, of course, of a day when her clients come to her and believe in her words to the extent of accepting what she says, after all their queries are addressed, of course, but in the meanwhile she will accept the conundrum they present to her in the OPD. And Dr. Wilona will keep going at her job, because that is the reason she breathes and leaves. Thank you for your time. Don't forget to like, subscribe and share. Do leave your thoughts in the comments section below. For similar type of article, please reach us at contact@thebespokediaries.com, or you can visit our website www.thebespokediaries.com.